ahead and get started. This lecture today or webinar today is on hormone optimization. And my name is Dr. Tina Ziainia. I'm the Chief of Women's Health here at Human Longevity and Performance Medicine. So let's get started. So what are hormones? Hormones are chemical messengers made by the endocrine glands that act to control certain actions of cells and organs. So the hormones travel around in your bloodstream to tissues and organs and work slowly over time and affect many different processes, including growth and development. They sort of work in a lock and key fashion. So for every hormone, there's a hormone receptor. And the age-old question is, do we age because we lose our hormones, or do we lose hormones as we age? I think for me, I think both. So let me talk about some symptoms of hormone loss. So some symptoms people experience, and they know that they're losing their hormones, are for women, the first thing is hot flashes. For both men and women, brain fog and memory loss, kind of like you're in a cloud or you're walking around in fog. You can't remember, things that you used to remember, and you think, oh, am I getting dementia or Alzheimer's? But it's just sort of the loss of your hormones with aging. Night sweats, weight gain, lack of focus, mood changes such as irritability, depression, anxiety. People that have never experienced anxiety, the first thing that I hear is, oh, I've become anxious and I don't know why. I've never experienced this before. And it's usually a drop or a change in their hormones. Joint pain, severe headaches, migraines, and decreased sex drive and or performance. Other things that I don't have listed here. I mean, it works in so many areas of the body, but for women, vulvar vaginal atrophy, where they get thinning of the vulva and the vagina, which then can lead to painful intercourse, dyspareunia. Sometimes people will come in and they'll think they have a yeast infection, they'll have itching from the lack of estrogen and the thinning of the skin in the vulvar vaginal area. For men, as we get older, we get sarcopenia, which is sort of wasting or thinning of the muscle. So for men with low testosterone, as much as they work out, they may not be building muscle mass. So let's touch on menopause. About 1.3 million women enter menopause yearly. Symptoms may begin up to 15 years earlier. And this is sort of like the perimenopause period. But people don't realize women are affected in more ways than they know, and they don't realize that they're entering menopause, but they may be experiencing some of the symptoms that I just mentioned, and this could be the start of perimenopause. So, some people feel, or they say, oh, you don't need to be on hormones. You'll get over, or you'll get through menopause, but that's not true. You never really get through or get over it if you never, replace the hormone that your endocrine or your ovary used to produce. The typical age is 50 to 51 years old, and it's defined by not having a menstrual cycle in 12 consecutive months. So if you have a menstrual cycle or a period, month 11, then you have to start the 12-month process over again. So it's not full menopause. You're still in the perimenopausal range. So I'm going to talk a little bit about men and andropause, even though there's sort of like a male menopause, or people joke the manopause. 38% of males over the age of 45 have low testosterone. It's very common in men with diabetes, hypertension, sleep apnea, alcohol and drug use. So if you drink excessive alcohol, which is considered 2 drinks a day, 7 days a week, 14 drinks a week, that would be excessive alcohol use, and other chronic diseases. It can also be linked to early heart disease, and it goes underdiagnosed. So a lot of men have fatigue or decreased energy, or they just don't feel right. And it's not always that they're getting their testosterone checked, but that's something that should be looked into. So facts about testosterone. People relate testosterone to the male hormone and libido and sexuality, but it's so much more than that. It's present in both men and women. Obviously larger amounts in men and smaller amounts in women. As men start to age, they lose about 1 to 3% of their testosterone production per year. For women, they can lose up to 50% a year, even starting after the age of 20. Mostly it starts around 30, but that's kind of the age range. It can provide major symptom relief and protects the bones, brain, breast, heart, and relationships, and also there's not a lot of studies, but it may also help the prostate or prevention of prostate cancer. We'll get more information as time goes on. So look at these testosterone thresholds I wanted to go over. So they're looking at the total testosterone in males and men. And so below a certain level here on this graph, on this chart, can lead to potential cause of disease. So if your total testosterone, even though the ranges are normal, they're not always, optimum. The testosterone is not optimum, even if it may fall in the normal range. I guess that's a better way to say it. So we want to see your total testosterone for men somewhere between 900 and 1100. And for women, somewhere between 150 and 250 in testosterone replacement. So for men, if they drop below 900, they may be prone to dementia or Alzheimer's disease. Once it drops below 840, it can lead to prostate cancer, early mortality. Below 770, you may see some metabolic syndrome or osteoporosis. Less than 600, you could have sudden death syndrome or early mortality. Under 450, type 2 diabetes, and then libido loss and fatigue around 430 or less, heart disease in the low 300s, and then depression, and then erectile dysfunction. So these are just some of the diseases that can cause with low testosterone. So I'm kind of jumping back and forth between men and women. I'm trying to make this an all-inclusive lecture, but estrogen, it's present in both in men and women, and men don't realize it. And men need some estrogen too. So of course, not as much as women, obviously larger amounts in women, smaller in men. This controls hot flashes. It maintains bone density, so osteopenia, osteoporosis. So when you lack estrogen, then you can have thinning of your bones. It can also help maintain memory. It maintains collagen in your skin. Everyone wants to stay young and look young. It also increases serotonin and dopamine, which are the happy hormones in the brain. And it helps prevent neurodegenerative conditions, lowers cholesterol, and increases HDL, which is the good cholesterol. So those are some positives about estrogen and the need and why you need estrogen. And I sort of touched on this earlier, but it's very important in the vulvar vaginal health for women to prevent atrophy in that area, itching, and dyspareunia, which is painful intercourse. So estrogen has a lot of benefits for women and men. And then, so hormone replacement therapy. So there's different ways that hormones can be replaced. So there's the oral route, which is through pills, transdermal route, which is through patches, creams, gels. There's shots that can be given. There's also creams and rings and things that can go intravaginal. And then there's subcutaneous route, which are the pellets. So there are different types of hormones. A lot of times there's confusion around synthetic versus bioidentical. Bioidentical means that the molecular structure of that hormone that you're replacing is similar to what the body produces. So for women, it'll be from the ovary, the estrogen, progesterone, testosterone, some from the adrenal. For men, the testicle. So bioidentical is hormones replacing what is similar to the body. And then synthetic is just what it means. Synthetic, there's a carbon atom or a molecular structure that's a little bit different, and the hormones are available that way also. So going back to for women, hormone therapy. So back in 2002, there was a WHI study, the Women's Health Initiative study that came out. I remember I was in practice then, so I've been in practice for a while now, but it was all over the Today Show, on Good Morning America, all the news stations, in the paper, and it basically said that you're going to have more heart attacks, stroke, breast cancer, blood clots, and Alzheimer's disease. So all female patients got off their hormones. And the study was done on Prempro, which is hormones. It's basically conjugated equine estrogen and progestin in a pill form. And it was done on women that were older age range with pre-existing conditions. And it was just the pill. But the study was stopped early for these findings. And so women were scared of hormones, went off of the hormone therapy. And then 10 years, after that, we saw an increased risk in heart attacks. We had women with painful intercourse, issues in their relationship, constant itching. Doctors were giving out fluconazole or antifungals for yeast infections when it was really just atrophy. So that's how, hormone therapy kind of became, people were frightened of it. So if you go to the internet now, you can find whatever you want. You can find information to support hormone therapy. You can find information against hormone therapy, but it really needs to be individualized to the patient. And, here at Human Longevity, we do precision medicine. So each patient is looked at individually and seeing, what's best for them, and which route is best for them and how that works. So in the end, we're sort of partners in health, and you have to decide if you want to be on hormone therapy. So patches, I'm not I've prescribed hormones in all different ways: pills, patches, creams, intravaginal injections, all of them. But I do feel that the patches are better than taking the pills for estrogen. So with estradiol, the levels are more consistent in the patch. You can place it on the front of the abdomen, the lower abdomen, or on the buttock. Sometimes you may notice some fluid retention with weight gain, but that will all iron out. But I think it's much better than taking like the estrogen orally. But the thing is, the skin is sort of made to keep things out. So sometimes you just don't know how much you're absorbing. But I do have patients that have great results on the estrogen patch. Mentioning that when we're talking about the patch, you should never take unopposed estrogen if you have a uterus, if you have not had a hysterectomy. You also need progesterone, and micronized progesterone is probably the best. And that's an oral pill that you take around dinner time or before bed. It helps you sleep better. It's sort of like the Xanax of hormones, gets rid of anxiety and you have better sleep. But you do need that if you're taking the estrogen patch. So there's also creams and gels for both estrogen and testosterone replacement. You rub it on your skin, the inner thigh, 1 to 2 times daily. Some people put the compounded testosterone on the labia or the inner thigh for men or for women, but it's sort of hard to gauge. Did you apply enough? Is it absorbing? And the downside is you can kind of transfer it to others. So men use a lot of androgel, and then they go and work out, and then who knows how much of that was absorbed, and they can also get it on their partner. So that's the downside, but it works for some people. And then looking at testosterone, there's also an injectable version where you can give yourself a self-injection once or twice a week. It's a synthetic hormone. The difference between, I'll get to the pellets in a minute, but there's more a roller coaster effect, and I'll get to a graph on that. You kind of get like a peak of testosterone and then a drop off, so you have to re-inject yourself. Sometimes the testosterone may wear off before your next shot, but it is also an option for testosterone replacement, and there are people that prefer the injections. And then this is to talk about the pellets. So the pellets are bioidentical. So they have a similar molecular structure as human hormones, as the ones that you produce. They're natural plant-derived compounds. They need to be inserted. They last anywhere from 4 to 6 months. So for women, usually they come once every 4 months, so 3 times a year. And for men, twice a year, usually every 6 months. Some people burn through it faster based on their cardiac output, and they have to come back a little sooner. But it would be anywhere from 3 to 4 times a year, depending if it's male or female placement. It's the most widely studied form of bioidentical hormone replacement therapy. It releases a steady stream of hormones in your blood. We do individualized dosing, so it's not one size fits all. It's based on what your hormone levels. We do hormone testing and your weight, and a bunch of things go into factoring how much you would get. It gets implanted under the skin, and it's hassle-free because once it's placed, you don't have to think about it. You don't have to rub something on your skin. You don't have to change a patch. You don't have to pop a pill every day. So that's where the only downside is it is a little incision, but we just put on a steri-strip. So it's not like you get sutures or anything like that. And obviously with an incision, sometimes people can get like an infection or pellet extrusion. So there are some negatives to it, but it is hassle-free, and people, once they're on it, they're pretty happy, and they're like, oh, I don't have to remember to rub hormones on my skin or change my patch or take a pill every day. So you do have to take a nutraceutical. I didn't talk about it here, so I'll leave that for another time, but you do have to take that just like you take your vitamin D and vitamin B12 and other things like that. So history of pellets, they've been around. They were developed in 1939 for women who had radical hysterectomies. The pellets only are for estrogen and estrogen and testosterone. We do not make progesterone pellets. So that would still be for women. They do need to take progesterone if they have a uterus to prevent the risk of endometrial hyperplasia or endometrial cancer. So they can't take unopposed estrogen. Men do not need to take the progesterone. The pellets have been used 80 plus years and in the US and other countries around the world. So they've been around for a while. So looking here, we're looking at the estradiol levels, pills versus patches versus pellets. So when you get the implant, we have the implant or the pellet placed in the subcutaneous tissue in the buttock. As you can see, the estrogen level is steady state and stays the same. Once you place the patch, you kind of get a rise and it's sort of steady. And then as the patch wears off, you get a dip and you put another patch on and it goes like this. But if you do oral estradiol, peak, valley, peak, valley, peak, valley. So, if you're going to pick the estrogen, I would go with a patch or even like the estrogel, which is bioidentical, or the pellet implant rather than oral. That's just my preference and what I've seen works the best. So with pellet therapy, which it sounds like I'm more prone to. I use pellet therapy on myself, so I would never prescribe something or give something to a patient that I would not take myself. I promised when I took my Hippocratic oath, I would treat all patients as if they were my family member. So I do the pellet therapy myself, but that's just a side note. So there's evidence based with years of clinical utilization, hundreds of studies, and over 75 years of use, and in 5 continents. It provides excellent symptom relief. So, and there's no roller coaster effect, and you get that steady state release. It's convenient and you're compliant because I'm the one putting it in for you. So you just have to come back twice a year if you're a man and 3 times a year if you're a woman. And we have seen significant increases in bone density. So if someone has osteopenia or osteoporosis, we've actually seen reversal on that. And we have not seen an increased risk in breast cancer, strokes, heart attacks, or blood clots that we've seen with some of the oral routes and things like that. So the studies have shown, hormone optimization is protective for bone loss, breast, heart, brain, and your relationship. So those are the pros of pellet therapy. So I'm going to touch a little bit on breast health. And I didn't do too many slides. I don't want to spend too much time. I know their time is precious, but the breast cancer studies, that's what people are worried about, getting breast cancer and hormone therapy. And so testosterone delivered by pellet implants does not increase your risk of breast cancer, unlike oral synthetic methyl testosterone. So women can take testosterone in oral form, but I think that the oral form has more dangers than the pellet. The implants show less stimulation of the breast tissue, and they also looked at testosterone and estradiol implants together and did not see an increased risk of the breast cancer. So that is actually excellent news. And so you still need to get your yearly mammogram and do your self-breast exam, but I would not be paranoid about the breast cancer, and not a fan of oral methyl testosterone. Was my preference. I do not prescribe that. I prescribed it before, but not anymore after learning more throughout my career. So looking at bone health, osteoporosis is a big factor in hip fractures down the road, which hip fractures can be debilitating and can cause early death. So both men and women can both get osteoporosis. And we know that replacing your testosterone in studies has shown to be a bone builder. Testosterone demonstrated a 4-fold increase in bone density over oral estrogen and 2.5 times greater than patches. So the sub-Q implants for testosterone, it was an 8.3% increase per year for testosterone therapy, 3.5% per year for patches, and 1 to 2% per year for oral estrogen. So both estrogen and testosterone help in preventing osteoporosis. And then looking at arthritis, 10% of men and 18% of women greater than 60 years old have some form of arthritis. And they think both estrogen and testosterone can stimulate precartilage cells and possibly reverse the development of arthritic tissue. So it does help with those joint pains and things like that if you replace your hormones. And then sort of diving into brain health, dementia, Alzheimer's. Women are more prone to get Alzheimer's disease, 8 times more likely, 8-to-1 over men. Women on estrogen are 50% less likely to develop Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. So it has a lot of implications in brain health. Some people do have a genetic predisposition to Alzheimer's, but we know lifestyle is responsible for 1/3 of our risk. So, excessive alcohol use again, smoking, not controlling your blood pressure, not controlling diabetes, being overweight or obese, not getting enough sleep at night. These can all lend to dementia and Alzheimer's, but also depletion in your hormones, mainly estrogen and testosterone. And looking at heart health, which is very important, especially when women enter menopause and also for men. So looking at women hormones in the heart, estrogen replacement with pellets has shown to be positive. It has positive effects on body fat in postmenopausal women as improved lipid parameters. So you get decreased total cholesterol, and LDL, which is the bad cholesterol, is the low density lipoprotein. And then you get increased HDL, which is the good cholesterol, and decreased triglycerides once you've been on the hormone therapy for some time. Adding the testosterone does not negate the favorable effects of estrogen on LDL cholesterol. You also see reduction in fat mass was seen with estrogen plus testosterone after 2 years. So people start losing fat and gaining muscle. So there's a benefit. I do have to point out there is no FDA-approved testosterone for women. It is approved for men, but not for women. So it's off-label use for women, but there are more testosterone receptors in the body than even estrogen in women. And a lot of people don't know this information. So, and then for men, the testosterone pellets may decrease total cholesterol and LDL. Once again, the bad cholesterol, increase the good cholesterol, which is HDL, and decrease triglyceride. So, with the workouts, they build more muscle mass, and there's a marked reduction in fat and improved lean body mass. So many studies show the beneficial effects of testosterone on the heart. So we really try to optimize those hormones. And I actually favor the pellet therapy more, but there are men that do the testosterone injections. You just have to be on the right dosing and make sure you're not converting too much testosterone to estrogen. All men need a little estrogen, but not too much. So some of the key takeaways, I just feel weird doing this webinar where I don't see if who's here, who's not, so I feel like I'm talking to myself. But here we go. The key takeaways of this: hormone imbalances can occur in men and women at any age. It's happened in young men and young women. Some women enter menopause, premature ovarian failure, less than 40, but menopause can start as early as 40 years old. There are men under 40 that have low testosterone. So these are things that need to be delved into. Hormone replacement therapy, there's a whole, different way to take all these therapies, and you need to sort of know the difference before you decide to delve in and replace your hormones. It's not a one-size-fits-all approach. It needs to be individualized to the patient and what their levels are, what their health risks are, and where their blood levels are and how they're feeling and what symptoms they're experiencing. And so when you look at the normal ranges, like for testosterone or estrogen or progesterone, it doesn't always mean it's optimal. Same thing with like vitamin D3. So vitamin D3, there's a wide range, 30 to 100. So people are like 32, 33. You really want your vitamin D3 to be optimized around 60 to 70. So if you're on the lower end of normal, it may not be at the optimum level, and your hormones will not be optimized if you have a low vitamin D3. We know that low vitamin D3 can make you prone to more infections because it has a lot to do with the immune function. There's some studies with vitamin D and breast cancer, so you want to keep that vitamin D in the correct range, and it's going to help optimize your hormones, help prevent depression and anxiety and things that come along with that. Thyroid is a whole nother lecture. I didn't really touch on that, but you want to always check your thyroid function test and see where you are and keep your, you want to be euthyroid. And then your B12, even though the ranges may be wide, you want to keep that around 600. So, so normal labs don't always mean it's optimal. So, that's about it. And, I don't know if I could take any questions. I have no idea who's on the Zoom, but I look forward to seeing you in the clinic, or if you would like to have any consults, you can come to the clinic and see me for a consult or Zoom or call. Let's see here. I think, let's see. Let me see if I can, I'm not very good at this, but I see there's some questions. So, okay. Pellets are significantly more expensive than other options, aren't they? It depends where you get the pellets. Here at Human Longevity, if you're a patient here, we don't charge, you know, you're obviously a member, so we do not charge for the consult or my time or the insertion. We just have to reimburse the company for the pellets. So just like you went to go pick up your prescription at the pharmacy. So for women, the pellets are, depending how many you get, it doesn't matter how much you get, it's $250, and for men, it's 500. But if you divide the $500 over 6 months, it's cheaper than getting testosterone injections, and the same thing for women. So like estrogel, it's not always covered by, you know, insurance. It's a bioidentical estrogen that you can rub on your arm. And I used to be on that before the pellets, and it was $120 a month. So I think it's more expensive than the pellets. So that's my answer to that one. Typically the cost to do the pellet implants cost is a lot of money. Do you charge for this, or is this covered? Okay, yeah. So all of the time, the consult and everything like that is covered. It's just the charge for the pellets, because we have to reimburse the company where we get our pellets from. And the pellets are regulated by the FDA and tracked by the DEA. It's just like if I were to prescribe to you an opioid. So it is tracked by the DEA and individually wrapped and all of that. And we do have to reimburse the company for that. And then what is the timeline for being on estrogen to reduce Alzheimer's? Or do you need to stay on this well into your 80s? I don't know if this webinar is dying, but they say with the estrogen, the benefit that they do see is like usually up to, you have to be on it for like 4 to 5 years to see that. And staying on it into your 80s would be an individual or a choice. If you go to 10 different doctors, you get 10 different answers. But basically, if you, a lot of gynecologists or women's healthcare providers or endocrinologists, because of the big bodies like ACOG and NAMS and all of that, they say to only replace the hormones for up to 5 years because of those other risks. But, you know, the tide is sort of turning on that, and we'd have to individualize it. I plan to stay on my hormones until I die, but everyone can do what they want to do. And does Medicare pay for the pellets? No, they do not. And insurance does not pay for the pellets, and we don't deal with insurance here at Human Longevity. And then outside of the clinic, it can cost anywhere from $800 to $1,000 for the pellet insertion. I don't know if you could find it for cheaper, even more than that, but the going cost is like about $800 to $1,000 for men. And I think for women, I've seen it around maybe $500, $650, but here it's only $250 for the reimbursing of the pellets and $500 for the male pellets. And it can cost thousands, because when you go outside of HLI, you're going in for a consult, and all of the different times you go to the office. We don't do that here. We just reimburse for the pellets. And why hasn't the FDA approved women to use testosterone? I have no idea. I think a lot of the research has been done on men, and I won't spend too much time on that. I have my ideas, but I won't say that here on this webinar. And how do you know you have low estrogen and testosterone? With symptoms, you could have symptoms of hot flashes, brain fog, libido issues, decreased energy. So all the symptoms we talked about. And then you can also test your hormones. But for women, once you start having irregular menstrual cycles or skipping menstrual cycles, that's how you would know. And you can also test for it with a blood test. Let's see, thoughts of HRT in a woman with history of estrogen. Breast cancer, I would not, for me, it's a contraindication. If you've had breast cancer that's progesterone, estrogen positive, I would not give hormone therapy. There are some practitioners out there that would just do testosterone alone with anastrozole, but that would be a whole nother lecture at another time. And yes, so I think if someone has questionable mammograms with biopsies, negative biopsy results, and no evidence of cancer, yes, it's safe to get the pellets. And the pellets can cause lumpiness in your buttock area. If you don't have a lot of fat there, yes, you can feel a lump as the pellets dissolve. My God, there's a lot of questions here. Do you need to be on hormones? If you're not having any symptoms, there's a need to take them. If you're not having any symptoms and you feel fine, there's not a need to take them if you have no symptoms whatsoever. But that would be hard to believe if there was low hormones. And then just because you have low testosterone as a man, how do you determine if it's safe to do the therapy for a man? Well, as we discussed, the low testosterone levels can lend to other diseases. So I think in men, we have to go over that person's history and see where their levels are and what other things are going on with their health. But yes, if it was very low in a man, which I've seen it as low as 100, I was shocked by that one. It needs to be replaced. And no weight gain with pellets. I haven't seen any weight gain with pellets, but obviously all of us are different. Sometimes there may be water retention. I think it's more with taking the progesterone, but then that kind of levels out. I've been on the pellets for over a year and I did not gain any weight personally, but it could happen. Is there an age cutoff to start HRT after menopause? It's best to start it in your 50s to 60, but there's no age cutoff. It's not something that I think I would start come in and say, okay, I want to start this at 80, but that would have to be individualized to the patient once again. And can pellet therapy help with weight gain and hair loss as a woman goes through her perimenopause? Yes, it can definitely help with weight gain and with hair loss. Now, testosterone sometimes can cause a little bit, like your ponytail may become smaller, you may lose a little bit of hair, but there's some thoughts that it would help with hair and definitely with weight gain. There are people that have gone on the testosterone that after being on it for 2 years, I met a doctor that did her pellets and she lost 50 pounds and she doesn't even exercise, but that's not routine for everyone. And then I hear that if you have a gene as a man that makes you have low testosterone, low testosterone may be normal. That one, I'm not sure. I'm not familiar with the gene that's going to give you low testosterone, so I can't speak to that. When do you use synthetic hormones versus bioidentical? It just depends on people's insurance and what they want to pay. A lot of times the bioidentical is cost out of pocket, and some people just prescribe me something that my insurance will cover. So that's when the synthetic ones are used. And there are some bioidentical ones that the insurance will cover, but for women, unfortunately, women's health suffers. So a lot of times insurance won't cover some of those hormones. So people have to pay. Okay. And then thank you, whoever was anonymous that said I did a wonderful job. I don't know. There's a lot of questions. If a woman is starting to have irregular periods during her perimenopause, should she start pellets or wait until she's fully into menopause and not having periods anymore? Yeah. So if someone is just having irregular periods and not into full menopause, you do not need the estrogen pellet, but you can start the testosterone pellet during the perimenopause, but I would not put in the estrogen pellet and I would individualize that to the patient. But yes, you can start your testosterone pellets as early as 30 years old if you're having symptoms and issues. Target estrogen for a man, level for a man is between 30 and 70. You don't want to be above 70. You don't want to be lower than 30. Okay. Yes, I treat men. I see all, though I'm OBGYN by training, I do see male patients and try to optimize their hormones with testosterone, whether it be transdermal gel, pellets, injections, whatever you prefer. So I do treat men. Is family history of estrogen-driven breast cancer a contraindication? It's not a contraindication for family history, no, only if you have breast cancer yourself, but obviously that's something to take into consideration. If money wasn't an issue, I would use bioidentical. That's what I use personally and for my patients. And if you have endometrial ablation, start having periods, at what point do you start HRT? So yeah, so you don't, if you've had an endometrial ablation, it's hard to know if you've gone 12 consecutive months without a period, because usually that can stop your period or slow down your period. So we do it based on your symptoms that you're having. If you're having hot flashes, brain fog, decreased energy, mood swings, difficulty sleeping, all the things, anxiety, things that come along with that, we test your hormones, blood test your hormones, and see where your testosterone levels are, where your estrogen levels are. And then we would talk about replacing that. Hormone replacement, part of the screening. Yes, we do total testosterone, free testosterone on all male clients as part of the 100 plus. And for women, we don't routinely do testosterone. It's kind of sort of out of the realm, but we can do that if you see me for a consult. If I don't know, you're an anonymous attendee, so I don't know if you're a man or a woman, but men get testosterone and women get estrogen, FSH, and that done routinely. What else do you have? Target testosterone for a man is like, if you're on the pellet therapy, is 900 to 11 for total. And then for pre-testosterone, it's sort of like the upper end of normal. It doesn't have to be way up the upper end, but on the upper end, depending what lab you use. And okay, thank you. I think that's it. If there are any more questions, I feel like I've been staring at these questions. I didn't know where they are. But I hope this was helpful. I'm happy to see any of you in consultation for your hormone therapy, and it can be done via Zoom, phone call, or in person. And I can answer more specific questions to your personal situation, your health needs. Okay. Thank you very much, everyone. I'm going to go ahead and I think I've answered all the questions, and I'm going to go ahead and hang up. Is that okay? See you all later. Hope you have a great rest of your week and weekend.